I think the importance is that patients get a chance to interact with the doctors and clinical nurse specialists, and that the information that that's given is better than anything they'll read anywhere else. And also I think for me, MPN patients have started a community amongst themselves, and it's about meeting other people. That's the problem with a rare illness, that you don't actually know too many people that have got it, and so actually joining in today is part of being part of that community. The first forum I attended was at St Thomas's Hospital in 2005, I think, and there were about 8 of us sitting in a room. And we then have built forums. The original forums just used to be in London. Now they go around the country. And this year, Maz and I will have done 9 forums altogether, both here and in Scotland, Wales, Northern Ireland, Southern Ireland, and reaching out to a huge number of patients, going from 312 patients in 2015 to over 1,000 this year. But more exciting is the fact that we are able to reach around the world, and we've become a truly global community with all the people at this patient day in London that are listening from Brazil, Australia, Canada, Syria, and to name but a few, and Australia. And I'm just overwhelmed with the fact that we are able to deliver our mission statement of providing accurate information and to support to people around the world. It's fantastic. MPND, it was a myeloproliferative disorder when I first became involved with it way back in 2006, 4, 5, 6, I can't remember. And there was a small group of patients that got together because at that time the information on the internet was pretty scarce. When I was diagnosed in '91, there were only 12,000 known patients in the country. Well, obviously there were a lot more, but there's the blood testing and science has come on so much, they're picked up much quicker. So what do we do? Our aim at that point was to provide accurate information and support both patients and the medical profession in understanding and helping people come to terms with myeloproliferative disorders. It was changed by the World Health Organization to a neoplasm, which had good and bad, because the word cancer is I think I said in my opening speech, the word cancer is a fairly scary word, but actually it's just a proliferation of cells. And on the basis of providing accurate information, we then raise money to give for research. The Mosaic study at the moment is the most important study. Most patients say, why did I get it? Why me? And will it be curable? And we're all hoping that the Mosaic study that's being done in Belfast will give us some clues. Also, I think, there are lots of drug trials that are going on now, and I think the community is just getting bigger. I mean, when I look at the original forums that we started in 2015, there were 312 patients attending. This year, we'll have done forums around the country, Scotland, Wales, Northern Ireland, Southern Ireland. We will have had over 1,000 people attending. It's phenomenal, actually. So, yes, we've got a full range of things that we are trying to do, and it seems to get bigger and bigger. But it's a great team, and we're very ably led by Professor Claire Harrison, who is brilliant at motivating us all, and I'm really grateful to be part and parcel of it. We've just heard a patient speak, a young patient speak, and it became very clear to me that the impact on her family was quite a difficult thing for her to come to terms with too. So I think in developing things further, more support for families. I think, again, increasing the support that we're already doing. Maz and I have already been asked to do additional forums next year. We'll have done 9 this year, and we've got new ones coming on stream as we speak. The other initiative that I think we're trying to do is develop a support system for young patients who have recently been diagnosed, because if you're in your teenage years and you're diagnosed with an MPN, it's a fairly challenging diagnosis to come to terms with and adapt to, particularly when there are things like fatigue to cope with. So there are lots of things. I mean, it's a really positive feeling that there's a lot of energy in the MPN community to advance. I'm also very impressed with what's going on in the advocacy group, that John Mathias has got a voice there with the pharmaceutical companies, so the MPN patients are represented and their needs are expressed to the pharma companies.